Here to talk about the effects of ketamine is Dr. Tom Pitts, a board-certified neurologist and, of course, friend of Morning in America here. Dr. Pitts, thanks as always for your time. There's a lot to unpack here, but before we get into the specifics of Perry's report from over the weekend, what exactly is ketamine and how does it affect the body?
Well, hey, Markie and Adrienne, thanks for having me. As someone who's directly treated patients for a variety of things with ketamine in the hospital setting and in the safety of the outpatient clinic, I have direct experience with this. So it is a dissociative anesthetic. What does that mean? It has an advantage for us. It works rapidly and it keeps you conscious, although dissociated from normal pain signals and other vital functions mediated by something called the NMDA receptor without us typically needing to put a breathing tube. So as you can imagine, we use this preferentially sometimes in children, in the emergency setting, sometimes in the burn unit. So it can be used as an anesthetic. More recently, we've noticed that at medium dosing, you can use it for pain. And then at lower dosing, you can have a transformative and healing space created for you at lower doses used for things like treatment-resistant depression and PTSD.
Okay, I was going to ask you if you saw this as a viable treatment option, but clearly you have used it before, and if done properly and safely, it is something that you have used and have advocated for. Dr. Pitts, this autopsy report found high levels of ketamine in Matthew Perry's system, but that same report, I found this interesting, that same report also said that lingering amount couldn't be from his last clinical ketamine infusion that was a week and a half prior to his death. So as a medical professional, how do you interpret that information?
Well, of course, not to disparage the man in any way. He was suffering from addiction. This is not like he woke up and said, I want to make a bad decision today, but that's exactly what happened. I mean, there's no other medical explanation. He got his infusion in the setting of the doctor's office. That's usually out of your system 3-4 hours through the urine, at most 12 hours, right? I mean, there's no way that that's still there. That's a higher dose than you might get at home. Some people are prescribed home ketamine. I don't know if he was prescribed it or if he got it illicitly, but he got into general anesthesia dosing. That knocks you out. That tranquilizes you. And of course, nobody would ever tell you to do that in a pool in any dose. And you should have someone with you. Spravato, which is an inhaled form approved by the FDA in 2019 at home for treatment-resistant depression, even requires blood pressure monitoring after 40 minutes of taking it. So the fact that he was in the pool, the fact that it got to those high doses, this is inappropriate. Whether prescribed or not, it was inappropriate use of ketamine.
Yeah, I know the FDA's only version of approved ketamine requires it to be given in a clinical setting, but some people who get it off the black market, it's nicknamed Special K. It has hallucinogenic properties. My last quick question for you, Dr. Pitts. I know there are millions of people who deal with anxiety and depression, who feel like they've gone down every avenue, who have yet to try ketamine. What should they take away from this story with Matthew Perry?
I mean, I would tell you, look, guys, 50% of liver failure in the United States, this is per the Liver Failure Registry, has to do with Tylenol, inappropriate use of Tylenol. So any medicine, it just happened to be ketamine, any medicine used inappropriately or in excess can cause a problem. He had 2 problems that would contraindicate him from the Columbia Clinic, which is where, of course, I was a fellowship trained. He had a history of substance abuse and he had meds that could interact, buprenorphine. So that should have been monitored closely. He's not your run-of-the-mill ketamine patient by any means. And it can be done safely with a medical team surrounding you, not at home in the pool.
Yeah, the secondary factor of death, according to this report, was drowning. He, of course, was found in his hot tub. Dr. Pitts, thank you so much, as always. We'll talk to you soon.
Thanks for having me.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.